Good morning. My name is Oscar Perez. I'm an SGU and PH candidate, and today I'd like to talk to you guys about measles. Measles, or rubiola, is a disease that is carried by viruses, and it was under relative control until recently. It was discovered in the ninth century, and is capable of causing a lot of death and infecting a lot of people. It's also known to cause substantial financial burdens when outbreaks happen. Fortunately, a vaccine was developed that is capable of providing immunity for measles, mumps, and rubella, other diseases. It's also known as the MMR vaccine. Prior to the advent of this vaccine, most of the people who became infected with measles became infected prior to becoming 10 years old. Vaccination campaigns that began in 1974 were very successful in decreasing the amount of people who were infected with measles. Eventually, these campaigns focused particularly on countries that had the highest amounts of deaths due to measles. In 1980, 2.6 million people were still dying as a result of measles. The development and distribution of the MMR vaccine, however, was a huge breakthrough for public health uh, because between 2000 and 2014, it is estimated to have saved 17.1 million lives. Currently, despite the availability of the MMR vaccine, measles remains a top cause of childhood mortality. In large part, this appears to be due to people who reject measles vaccination because they have been influenced by multiple erroneous and false stories that suggest that measles vaccination, the MMR vaccine, is linked to autism and other adverse events. Unfortunately, because of how infectious measles is, only a few unvaccinated individuals are needed to expose the population and spread the disease. Let's talk about how measles is passed from one person to another. Measles is very contagious. It is estimated that the people who aren't immune have a 90% chance of contracting measles from an infected individual who is a close contact. It can be passed from person to person through respiratory droplets that are created when somebody who's infected coughs or sneezes. Uh, when those respiratory droplets make contact with mucosal surfaces, like the mouth, the nose, and the eyes, the droplets can remain infectious for up to 2 hours, even after they've been expelled from the body. Those who are infected with measles can start to transmit the disease when 4 days prior to developing a rash and 4 days after developing the same rash. Measles has only been found to cause disease in humans and is only transmitted from human to human. Measles presents with a number of signs and symptoms. For example, symptoms like fever, coughing, runny nose, and pink eye uh, can be developed 1 to 2 weeks after the initial infection. There are also two characteristic signs of measles: Koplik spots, the picture on the left, which are blue-white specks that can be found in the mouth, and the rash that starts in the head and spreads towards the legs. That's the picture on the right. However, there have been recent suggestions that Koplik spots can be found in other diseases, so Koplik spots might not be specific to measles. If measles progresses, it can cause pneumonia, an infection of the lungs and the main cause of death in measles-infected children, encephalitis, an infection of the brain, diarrhea, and ear infections, which can eventually lead to deafness. Additionally, subacute sclerosing panencephalitis, a debilitating nervous system disease, can also develop years after the initial infection. There are a number of factors that are used to diagnose measles. The presentation of fever, cough, runny nose, and pink eye is not specific enough, but it can suggest measles. The the measles virus itself is part of the paramyxovirus family of viruses, whose members, which are responsible for parainfluenza and mumps, are all cause cells in the lungs to fuse and form cells with multiple nuclei. as mentioned previously, couplic spots and that descending rash are also can raise suspicion for measles. The gold standard for diagnosis of measles is a PCR, the discovery of IgM antibodies in blood samples and measles RNA in respiratory samples in PCR, polymerase chain reaction, which is a method for detecting molecules. Urine samples can also be complementary to find the diagnosis because measles RNA can also be found in it. To ensure that the symptoms that a patient may be experiencing are not due to a recent MMR vaccination, sometimes further molecular analysis, genotyping, is needed to identify the virus and make sure that it's not just from a vaccination. Certain groups of people are more susceptible to measles than others. Measles can infect anybody who is not vaccinated. 2-year-olds and younger children are most susceptible to becoming infected with measles. This is in part because those who are not fully vaccinated, those who are younger than 1 year of age, generally can only have up to one dose generally, are still susceptible to infection. I'll talk more about that when we get to the vaccination schedule for measles. In addition, more severe illnesses and a higher number of deaths are seen in compromised and malnourished children. Measles is also seen more in less developed countries. There are a number of actions that we can take to prevent measles from flaring up. The most effective action that can be taken to prevent transmission of measles is vaccination. The measles vaccine is given in 2 steps. The first step, which is 93% effective, and the first step is about 93% effective, and the second and combined with the second step is about 97% effective in preventing a measles infection. The first dose is given within 3 months of the first year of life, and the second dose is given between the 4th and the 6th year of life. Additionally, the use of appropriate personal hygiene is a basic action that should be employed to prevent any infection, to help prevent any infectious disease transmission. As has been mentioned, one of the reasons for the resurgence of measles is the voluntary choices that are made about rejecting the MMR vaccine because of probably false links between it and adverse effects like autism. The end result is that many of the people who are infected with measles transmit the disease to infants who haven't yet been fully vaccinated. Targeting measles will likely require 2 different approaches, one for wealthy countries and one for underdeveloped countries. In wealthy countries that harbor the anti-vaxxer movements, information campaigns are still the suggested course of action. In underdeveloped countries, dedicated surveillance activities and thorough vaccination outreaches are likely to have good results. Active cases of measles are handled in the following ways. Exposure to measles is treated with a prophylactic administration of the MMR vaccine, which happens within 3 days, or of the immunoglobulin, which happens within a week. Treatment of active measles cases is supportive, so lowering fevers, hydrating the patient, managing the pain. Vitamin A is also often added to prevent or limit a skin disease that can come with measles. Additionally, those who have been found to have been diagnosed with measles should also be isolated for 4 days after they develop a rash to make sure that the disease isn't transmitted further. This is a very serious communicable disease that eventually can cause a lot of problems, as I've tried to explain. Determining the source of the infection is also key to prevent further cases from emerging. As such, detailing the locations someone infected with measles came from and has visited is key. In addition, the people who have been in contact with somebody who is infected with measles have to be told of their at-risk status and must be examined for measles susceptibility. Here are some of the references that I used, and that's the end of my presentation. I hope everyone enjoyed it, and if there's any questions, please feel free to reach out to me. Thank you very much, and I hope you guys have a good day.